I'm Dr. Sreekanth Shetty, Director and Head of Cardiology at Sakra World Hospital. Cholesterol is a waxy substance that is an essential part of our body. It is present in very crucial locations such as the cell membranes. It forms part of the covering of the brain cells and the spinal cord neurons. So obviously, cholesterol is a very important chemical needed by the body. So why does cholesterol become a problem? When cholesterol levels in our blood increases, then it leads to deposition of plaques in the arteries all over the body, particularly in the heart's arteries, brain arteries, or in the arteries of our peripheral limbs. This causes reduced blood supply to the respective areas, leading to strokes, heart attacks, or peripheral vascular disease, which have dreaded consequences. They increase mortality and also cause disability. Evidence has built up over the last several decades about the importance of high cholesterol, particularly of LDL cholesterol, which is bad cholesterol, in the causation of heart disease. We have to understand this concept of what we call lifetime exposure to high LDL cholesterol, which means if as a young individual you have extremely high cholesterol, then your chances of developing heart disease over time is higher. Therefore, it becomes important to treat high cholesterol, particularly in the younger individuals. There is often a lot of resistance from young individuals to take cholesterol medications, particularly statins, because there are a lot of misconceptions about statins or high consciousness about their so-called high awareness about their side effects, which are often exaggerated. If your LDL cholesterol is very high and if it is above a certain threshold and we feel that it is not going to come down to the target levels with just lifestyle measures alone, then you need to take the medications, that is statins, to get the LDL cholesterol down. For this, we have what is called a risk-tailored approach. It is not a one-size-fits-all kind of an approach. For example, in a diabetic individual, we want the LDL cholesterol to be less than 100. So even if it is 130, we would start them on cholesterol medication. In somebody who has blockages, heart disease, stroke, etc., at any level of LDL cholesterol, we will give the cholesterol lowering medicines because we want the LDL cholesterol to be lower than 50. Suppose you do not have any other risk factors and your LDL cholesterol is high, at what level would we consider starting the medication? If it is above 190, straight up front, we will advise medication. If it is between 160 and 190, we will try lifestyle changes for about 6 months, and then if it doesn't reduce, we will start medicines. And medications, if we are certain that we are above a threshold where medications are needed and lifestyle alone is not enough, then we will continue it long term. This has to be accompanied by appropriate lifestyle changes such as exercise, weight reduction, a low-fat diet, avoiding simple carbohydrates like sugars, and maintaining an ideal body weight of a BMI of around 23. All these along with the medicines will help maintain your cholesterol, LDL particularly, at the target level. How about triglycerides? Triglycerides above 500 will put you at risk of pancreatitis, which is a severe acute abdominal emergency. Therefore, any triglyceride above 500 needs to be treated with medications along with lifestyle. If your triglycerides are between 150 and 300, then it is a reflection of a poor metabolic condition, which also increases your risk of diabetes. One often is seen to have abdominal obesity, fatty liver, and a higher inflammatory state. Therefore, such a kind of an elevation of triglyceride has to be also seen in a larger context, and the patient needs to focus on weight reduction and proper diet to get the triglyceride levels down to less than 150. What is HDL cholesterol? HDL cholesterol is a good cholesterol. It takes the cholesterol away from the blood vessels to the liver for metabolism, and therefore higher levels of HDL cholesterol are protective. While we do not have any good medications to raise HDL cholesterol, all the right things that you do with your lifestyle improves your HDL cholesterol.